Hey all, Keith Littlewood from Balanced Body Mind. I had a couple of questions in this week about clients who were suffering from acid reflux. You know, that unwanted burning sensation you often get in the esophagus. There are a few reasons why people get acid reflux, and sometimes it's not even related to acid at all. In fact, in most of the clients that I've seen and worked with, those who actually have a real-time overproduction of acid is very, very rare. Here are some of the main reasons why people often get acid reflux and ways that you can go for assessing and treating the problem of having that unwanted acid reflux, if indeed it is actual too much acid being produced. So one of the main reasons, and one of the most common reasons why I see acid reflux, is due to a bacteria called Helicobacter pylori, colloquially known as H. pylori. This is a helix-shaped bacteria that likes to bury into the lining of the gut, and more often than not actually lowers the amount of stomach acid that's being produced. Helicobacter pylori has been classified by the World Health Organization as a known potential carcinogenic of the gut and the abdomen. So how does that happen? Well, if you think about this bacteria burying into the gut and lowering the amount of stomach acid, it can actually be responsible for also making stomach ulcers as well. So determining whether you have a Helicobacter pylori infection is very, very important. The problem with the H. pylori treatment from standard medical approach is often known as the triple therapy, which are 2 doses of antibiotics and also a dose of proton pump inhibitors, which are known as Nexium or omeprazole, which lower stomach acid. Now, some of these stomach lowering acid agents do have their problems, especially with long-term use, and obviously multiple uses of antibiotics. It can get rid of it in some cases, but most bacteria, as we know, do become resistant to antibiotics. So if there is actually a known infection of H. pylori, which can be determined from a breath test, a stool test, particularly a PCR or DNA analysis of stool and bowel function, then that needs to be treated, and that can actually be treated reasonably well with quite a few botanical supplements to get rid of that. Moving away from the H. pylori infection, there are a couple of other reasons why people tend to have a burning sensation. I've often found that with certain foods, sometimes flour-based products may cause a sensitivity, sometimes caffeine, sometimes red wine, and then totally indiscriminate foods. So it's very easy, despite having, there's no need to do lots of expensive tests to find this out. If you find that after, or immediately, or within half an hour to an hour, you are getting this acid reflux, note that food down and then remove it. It's simple, you don't need to spend lots of money on tests. Another reason why we tend to get sometimes this reflux, it can actually be related to hormone dysfunction. Bear in mind that our adrenal and thyroid hormones have a huge impact on how our bowel functions and our digestive system functions. And when we're stressed, we can have various knock-on reactions to how we digest our foods, how hydrochloric acid is actually produced. And in some aspects, it's actually been shown that alkali refluxing from the small intestine can actually produce that burn that's associated with acid reflux. There's another reason as well, which is related to how the diaphragm functions. Bear in mind that the diaphragm is used for breathing, so as we breathe in and out, we should see our belly moving away from the spine. Now, the diaphragm also has another role, which is related to increasing esophageal pressure. So the esophageal sphincter pressure should actually be maintained by the diaphragm, and when we have inverted breathing mechanics, we can assess if that's impacting on how we digest our food and the amount of pressure that's produced to maintain the actual acid within the stomach. So we can actually have a real-time acid reflux. It depends on how much acid the person is producing. So it could be a structural related to breathing. It could be bacterial related to the Helicobacter pylori. It could also be related to chemicals, hormones. If we're producing too much adrenaline, this may have an issue if our thyroid isn't functioning as well as it could be. So before going down the route of having triple therapy, using proton pump inhibitors, because you may not actually producing enough stomach acid in the first place, have a look at these key things such as monitoring your food, seeing how you breathe, and if you don't get any let up, then go down the route of having a stool test to actually find if you have an H. pylori infection, and use the spending and the money and the tests as your last resort, because there's a lot that you can do by finding out how your body functions on your own. Check it out, it's a lot easier than you think, and if you have problems, consult someone who knows how to deal with digestive problems.